I'm by the names of Salvatore Samaza. I'm going to talk about the variants of multiple sclerosis with the management. First of all, we have to understand what is multiple sclerosis. Multiple sclerosis, it's chronic demyelinating disorder which affects the central nervous system and affects the communication between brain and other parts of the body. This happens due to the autoimmune reaction. The antibodies to fight against the disease, they are the ones to fight the body itself. So by understanding the multiple sclerosis, we have got four variants of multiple sclerosis. One is relapsing remitting multiple sclerosis. Relapsing remitting multiple sclerosis, it means that it reaches the time, as the definition says, relapsing. It reaches the time of progressing into serious symptoms. Then that time of symptoms, it stops, it comes again. It stops, it comes again. As the picture shows, as time goes, the disease rises and goes up, progress. Then later it goes down. Again it progresses. Temporary times of progressing, then stopping. Then the other one is primary progressive. Primary progressive means that primarily to progress completely, directly as the graph shows here. This is the disability, this is the time frame. The other one is secondary progressive. Secondary progressive, it starts first with symptoms, then it stops, then it continues growing as time goes. Progressive relapsing, it means that it takes the time to the course to progress, then it reaches the time it stops completely. Those are the variants of multiple sclerosis. Coming to the management of multiple sclerosis, it can be managed in two ways, either medical or physiotherapy. Medical management, it involves the disease-modifying agents. These agents are the ones which tries to modify the disease so that the person can be better. Corticosteroids therapy and pain relief therapies. These are used to reduce pain in various parts of the body which is affected by this disease. Fatigue management by using hydrochloride. Then spasm management of medical spasticity management. Baclofen, diazepam can be used to manage spasticity in this MS disease. Apart from medical, we have physiotherapy. Physiotherapy assesses and helps in sensory deficit management. Sensory deficit, it means that we will try to protect the sensory parts to sense properly. Exercise training can be circuit training or group training where people come together and practice together. In circuit training, it means that we will be having time schedule for doing exercise. We get the time for rest, interval for resting, like that. Functional training, this comes last when a patient is progressing. We have to teach him on the activities of daily living, so that he can cope up with the environment he's living in, either grooming, involving of bathing, brushing, and everything. Speech and swallowing therapy, you have to focus on this also, so that a person is able to manage speech and is able to take his diet well. Physiotherapy also, it can assess and help to manage the pain through hydrotherapy, which will even help in improving the ranges of motion and exercises which has to be given. Fatigue training has to be given so that a patient will avoid fatigue during walking and doing other activities. Thank you very much. This is all about the variants of multiple sclerosis and management. Thank you.